Hi there, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. All right, today we're going to the whiteboard to answer what's the difference between these four sources of stem cells: adipose, bone marrow, embryonic, and umbilical. All right, we're going to start at embryonic. Embryonic stem cells are pluripotent, meaning they could turn into any type of specialty cell in the whole body. That is the holy grail of stem cell therapy. However, there are a few problems with embryonic stem cells. One is they come from aborted fetuses or maybe a leftover embryo after an IVF procedure. Notwithstanding the ethical considerations, they're not safe to use. They immediately get rejected from the human body, and they can form tumors. So because of that, they're not safe. We don't use them. All right? Anybody who offers you an embryonic stem cell procedure, turn around and run. Okay? So let's talk about adipose and bone marrow. Adipose means fat. So the tissue would come from you. It would either be from your belly or from the flank. All right? And the usual amount is about 60 cc's of fat that would be removed, okay? It has to be your own fat. It can't be an unrelated donor because it'll get rejected, all right? So that's called autologous stem cell therapy, and it's a good second choice if you're adamant about having your own stem cells rather than umbilical, okay? So I'm going to put a 2 here, okay? Bone marrow. Bone marrow stem cell therapy has been getting less and less popular as the minutes go by, okay? Why? Well, first of all, it can be pretty painful to have it done. The source is your pelvis, either from the front or the back of the iliac crest. Now, studies have shown that as we age, the amount of stem cells we have in our bone marrow drops off a cliff after the age of about 30, all right? So by the age of 40, it's about 50 times less stem cells in your bone marrow. By the age of 60, it's about 200 times less. And by the age of 70, it's less than that, 200 or 300 times less. So if you're getting a bone marrow stem cell procedure, you might as well call it a glorified PRP therapy. As I mentioned, it can be painful, and there's just not many stem cells there, okay? So, umbilical. Umbilical cord tissue is what we use almost exclusively throughout the world. Now, umbilical cord itself is a wonderful source of mesenchymal stem cells, exosomes, growth factors, cytokines, peptides, hyaluronic acid. It is a fantastic source of regenerative elements. I call it a virtual orchestra of elements, okay? It's great. Now, the great thing about umbilical cord tissue is it's very consistent with regards to how many cells and how many regenerative elements we see. Also, these cells are as young as you can imagine. They're very active, they're pure, they're potent, and we see impressive results. They also do not get rejected by an unrelated recipient, right? The scientists refer to it as being immunologically privileged. They don't have MHC2 markers, so they don't get rejected. So they're basically an off-the-shelf type of fantastic regenerative option, all right? So number 1 for umbilical, and then adipose would be a distant second option, okay? And you can only have that done to yourself, right? Because it does have MHC2 markers. It would get rejected if you got it from somebody else. All right, that's the difference between the four main options. Visit us online today at r3stemcell.com. We have over 70 centers in 7 countries around the world. We are the world's largest provider of regenerative therapies. Give us a call today at +1 for the USA, 844-GET-STEM. We'll set you or a loved one up with a free consultation. Thank you.